Hello, everyone. Welcome to another review class for our practitioners from the Philippines. And today we shall be discussing the acupuncture points that we use for the different patterns of rheumatoid arthritis. Last time we discussed the different patterns, and now we shall be focusing on the points. And we know that RA is a chronic inflammatory disorder targeting the joints, and this will cause pain and swelling. It can also affect various organs and systems. So that's why you have a range of systemic complications. And so early diagnosis and management are crucial to improve the quality of life and to prevent long-term damage. Okay, what are the causes or etiology of rheumatoid arthritis in TCM? The first one is invasion of wind. So this is associated with P syndrome. And so if there is P syndrome, there is pain in the joints and you cannot move the joints. There are mobility issues. So in TCM, we see the wind as an external pathogen that can cause sudden onset of symptoms. Another cause would be invasion of cold. So this will contribute to stiffness and pain in the joints. This is also under P syndrome. In TCM, cold can contract and obstruct the flow of qi and blood, and so this will exacerbate your symptoms. Another cause would be invasion of dampness. Okay, so those are the top three: wind, cold, dampness. And this will cause heaviness and swelling in the joint. So the patient will say, why is my joint feeling heavy? No? So this is the result. Dampness is the result of poor diet and lifestyle, so is choices. And so this will lead to accumulation of phlegm in the joints. Another cause is due to abuse of the kidneys. Okay, this is a contributor to RA. So if you have kidney deficiency, your bones and joints will lack nourishment, and then this can result in chronic issues relating to bone health. Another is when you have yen qi deficiency. So this is original qi, which means that there is lack of vital energy that will weaken your body's defenses. And so you are very susceptible to RA. So we can say that there is a genetic component here. It's something that you inherited from your parents, maybe. So it is considered essential for overall health and immunity. Next is latent heat and irregular diet. So did you know that immunizations can cause latent heat? No? And irregular diets will make you accumulate heat and dampness in the body, causing phlegm to settle in the joints. Don't worry, for those who, of course, I think almost all of us were immunized. We have a way of dealing with it using acupuncture. That's what we call latent heat. So, what are the core treatment principles for RA? So, this include, of course, you have to expel wind from the body, no? Remove the wind, resolve the phlegm accumulation, and invigorate blood flow. So it is important to clear latent heat, so eliminate toxins and nourish the liver and kidneys, while you also tonify your original qi or yen qi to restore balance and health. Okay, understanding the underlying mechanisms is essential for effective treatment. So if there is dampness, that means you have joints that are swollen and the feeling of heaviness. Okay? Heat, when you look at the joints, they are red and they feel hot. Okay? There is inflammation. Phlegm means swelling and deformities. No? Swelling and deformities, that's phlegm. Blood stasis, oh, there is intense pain, and the pain is worse at night, no? Because you don't do anything at night, you just sleep. Deficiencies in the liver and kidneys, there will be cartilage destruction and compromises the joint integrity. The wind, just like the wind, the pain goes around, no, that moves around from joint to joint, no, and this will complicate the condition. Cold intensifies the joint pain, and almost always it is only one joint. So if it's only one joint, not both joints, the cause could be cold. So these are the general acupuncture points for RA. I submitted to Ma'am Letty as a way of saying goodbye. The points, the presentation, no, for this presentation, so that you can have something to always refer to when you see patients with RA. GB34, this is a gathering point or Hui point. Also bladder 11. Local points for treatment, ASHI, 2 my points, and also Dr. Chow Yu Mei's formula, which we will discuss later. So what are the key acupuncture points for acute damp heat? Lung 7, Li4, Li11, Santiao 5, and Santiao 6. To treat damp heat so that you can release by releasing the exterior and expelling winged heat. Okay? Now, resolving damp heat. We use RAN 9 and spleen 9. Okay, and you will be able to address the internal imbalances that contribute to RA. In fact, when you start pressing these points, they are so tender. Okay, Hui points or gathering points or meeting points for the sinews and bones. We have GB34 for the sinews and bladder 11 for the bones. Then they will reinforce the treatment of acute damp heat by enhancing the overall joint health and mobility. What about for those who have chronic issues? Chronic damp heat, no? Matagal na matagal na. So we target specific acupuncture points like RAN 9, LI11 because of the heat, spleen 9. So remember dampness, RAN 9, spleen 9. And this will effectively resolve the damp heat. And to expel the wind, you need Santiao 5 and Santiao 6. Okay, then of course the Hui points, GB34 and bladder 11. So what about wind cold dampness treatment? No, this is also very common, especially if you live in places that are not only windy but cold. Okay, so we do initial assessment. Okay, so first you need to be able to identify symptoms like joint pain and stiffness. Then you select the acupuncture points, automatic, because you want to eliminate that damp, that wind cold. You use Santiao 5, Santiao 6, and GB31. For chi movement, we make use of RAM 6. And for dampness resolution, think of RAM 9, spleen 9, RAM 12. And for final adjustments, of course, you use the waypoints, GB34 and bladder 11. Okay. So there, review. Next, wind dampness heat. So wind damp heat treatment. Okay, so we do the very favorite Santiao 5, Santiao 6, GB31 to expel the wind effectively, addressing the acute symptoms associated with wind dampness heat. And of course, the triad, RAN 9, spleen 9, and RAN 12, no? To resolve dampness. And you'll be surprised if you needle these points, you will notice some improvement in the coating. Okay? Yeah. Li11 to 14 to clear heat from the body. Okay, you know where these points are, I'm sure. To reduce inflammation and discomfort. Then GB34 and bladder 11, these are Hui points. No, GB34 for the bones, for the sinews, and bladder 11 for the bones. Okay. Now, cold and heat combined treatment. Okay. So how do you do this? So you have to resolve the phlegm. So we use stomach 40, RAM 12, spleen 6. No, these are very good for phlegm accumulation. And you have to make the blood move. Okay? a very good point would be PC6 and spleen 10 and liver 3. Okay. Then you have to resolve dampness. Our favorite points, run 9 and spleen 9. To tonify chi and blood, of course, there's the ever reliable stomach 36. Next, what about for phlegm and blood stasis? Okay. Key points. Remember, stomach 40 is the best. It's called the phlegm point. Okay. Round 12, round 9, spleen 6 to effectively resolve the phlegm, to make the blood move and to eliminate stasis, PC6, spleen 10, and liver 3. And of course, you should not forget GB34 and bladder 11. Now let's go to cold dampness. You have to be, because cold is so painful. Remember, it's only on one joint most often, no? You have to resolve dampness effectively, expel the wind using Santiao 5, and then you have to use GB34 and bladder 11. Okay? So what about wind dampness? No? Santiao 5 to expel the wind. Santiao 6 to move the chi. This is also my favorite point for constipation. So Sister Rosa, that patient may benefit, no? I have a feeling that, she must have a little bit chi stagnation. Try Santiao 6.
Thank you, Doc.
Yes. You're welcome. GB31 for the wind symptoms. Run 9, our favorite run 9, spleen 9 to enhance digestion, and of course the waypoints, GB34 and bladder 11. Okay, what about if you have a patient who's not so young anymore and who has been working hard for the last, before he became a senior? So the RA could be due to liver and kidney yin deficiency. So what are the points? Of course, we have spleen 6. We know for a fact that spleen 6 can actually treat 3, no? Sun in Tiao, no? So this is like liver, kidney, and of course the spleen. Liver 8, this is the tonifying point of the liver to support liver function, and it can help replenish the yin. Stomach 36 for tonifying the chi and supporting the overall health of the body. Kidney 3 for nourishing the kidney yin. Ran 4 to strengthen your essence. For elderly, you should not forget to needle ran 4 because they need to replenish the yin, the essence, no? GB34 to promote flexibility of the sinews, no? Bladder 11 to support the bones. Bladder 18 for the liver to address stagnation. Bladder 23, you know this, the bakshu of the kidney, uh, to enhance the kidney function. Okay? Okay, acupuncture. Okay, what about the selection of local points, no? Of course, they want to get rid of. Earlier, we were discussing more about the causes, the etiology. Now let's go to the immediate relief. Okay, without forgetting the etiology, of course. So for wrist and finger pain, you will use Santiao 4, Li5, and Si5. Don't worry, I gave this to Ma'am Leticia Aboy. You can ask a copy from her, no? And also for stiffness of the, okay, for wrist discomfort, Santiao 4, Li5, and Si5. For stiffness of the fingers, Si5, Li5, and Si3. Now for toe and hip pain, there are many patients who complain of toe pain and hip pain, no? Okay, so for the finger, okay. Yeah, bakit naabot? Okay, for the toes, we have spleen 4, bladder 65, and bafong. And then for the hip, GB30, GB29, and GB39, especially GB30. Okay, so that's about it. Thank you so much for listening.